This podcast is for informational purposes only and does not provide medical advice. Always consult your physician or other qualified health provider with any medical questions and never delay care because of something you hear on this podcast. Welcome to Prostate Cancer Real Talk. Did you know that 1 out of 8 U.S. men will be affected by prostate cancer? And Black men are 50% more likely to be diagnosed and twice as likely to die from it. Meet Ellen Shea, a married couple impacted by prostate cancer who have faced it, fought it, and defeated it. Join in now where we answer questions, share personal stories, and fellowship in our safe, judgment-free space. Expert guests include urologists, surgeons, researchers, counselors, nutritionists, patients with their families, and more. If you or someone you know has been impacted by prostate cancer, you've found a welcoming place for information and support. In this episode, we welcome Ralph Jones. Ralph Jones is CEO of Youth Development Systems, Inc., specializing in enhancing academic performance through online chess and STEM training. With decades of experience in finance, system design, teaching, and programming, Mr. Jones faced a prostate cancer diagnosis with a PSA reading of 600. Through care at UI Health in Chicago, he successfully reduced his PSA to near zero and now shares his clinical trial experiences. Ellen Shea, take it away.
Thank you very much, Dennis, for that wonderful introduction, and welcome to the show, Mr. Jones, Ralph, and Shay. We're really pleased to have you with us today. Shay?
Hi, Ralph. How are you?
I'm fine. I'm glad to be here.
Oh, great. Thank you so much for being on. So in that intro, we just discovered that you were diagnosed with prostate cancer. So can you tell us a little bit about that and perhaps like what year you were diagnosed with prostate cancer? And the amazing thing, which we've never heard before, you had a PSA level of 600. So tell us a little bit about that.
Well, okay, just a little quick background. I had something called a carcinoid tumor, and that carcinoid tumor had metastasized to my hip. And in the process of going through and analyzing and examining that, I was told I should go and see a urologist. And I wasn't real clear what the issue was, but after I saw the urologist, they told me that they had done an analysis and that I had a prostate cancer that could also be contributing or had metastasized to my hip. And that prostate cancer, they explained to me that the normal range of PSA was from 1 to 4. And they told me mine was 600. So my wife says I have a way of compartmentalizing things. I can put it in a corner and wait till I have to bring it out. But I have to admit that worried me, okay? And then I had a biopsy, and they went in and did the biopsy, and I think they did the biopsy of the prostate in 4 quarters, and 2 of the quarters were absolutely contaminated. So at that point, I thought I was in not really good shape, and my history or relationship with prostate cancer had not been good. My father had prostate cancer, and my father. This was a long time ago. I think it was like 1991, and at that point, they didn't give you a whole lot of options, or there wasn't a lot of discussions about what kind of studies were being done. It was like, you got to have it removed.
Okay.
Okay. So he had his prostate removed. Now at that point, he was already 72 years old. He was about the same age I was. So a lot of the issues that arise from having prostate cancer and prostate cancer surgery, the ones that, that have the sexual overtones and whatever, it's a lot better when they come at 75 than 55.
Right.
Mhm.
I won't say they're better. Let's say they're less potent. Okay.
Okay.
So,
Go
Ralph,
ahead.
let me ask you this, if you don't mind. So, for it to be 600, had you not been having your PSA screenings, or because that number is just so large? So, had you had PSA screenings in the past? And
I didn't know what a PSA rating was.
Mhm.
That was the first time I had heard it was an issue. And as I look back on it, the whole process was a little upsetting
Yeah.
because every time I fill out a survey when I went to the doctor, a new doctor or annual survey or whatever, the question always comes up is what relatives had what cancers. And I always check that my father had prostate cancer. And you would think someplace in that process, it would have ticked off, maybe we should give this guy a PSA test and see what his rating was. But the first time I ever heard that I had a PSA rating, it was 600.
And at what age was that?
I was 70, 73.
Hey, listeners, metastatic prostate cancer means that the cancer has spread from the prostate to other parts of your body. If you or a loved one has been diagnosed with metastatic prostate cancer, consider a Pfizer clinical trial as your next step. To check your eligibility, go to www.mevpro-studies.com. That's MEVPRO-studies.com. So one of the things that we talked about, you and I, prior to the show, was using yourself and your story as somewhat of a case study and an inspiration for younger men to make sure that they're getting their PSA screens younger in life. I started mine in my 40s, and thank God, when I was diagnosed with prostate cancer, my level was, like a 7. All right, it wasn't 600, but thank God for the early testing or the early screening, which helped me catch it early. And so, what we want to do is to uh, hear from you, as you've already started talking about your advice to younger men. And when I say younger, I mean 40 plus, 40, 50, 60. What is your advice to them as it
Well,
pertains to getting their PSA screenings?
okay. Let me just say, if I had um, any background or any education or had privy to shows like yours when I was 40 years old, I would have definitely started to have the PSA. I mean, my advice is to do it because uh, it's it's not good. It doesn't get better, and if you don't catch it, and your options and the results are limited. And one of the other things I would have to say is I had a friend, one of my best friends. Uh, he was diagnosed with prostate cancer when he was about 68, and at that point, this was about 2000, 2013, something like that. And at that point, they were still telling people that a lot of black people, a lot of black men get prostate cancer, but it probably won't be what kills them. And in the case of Jack, it is what killed him.
Oh,
So if I had the short answer is if I had known better, I would have done better. And I would suggest that since you're trying to get the word out to younger black men, they know better. They ought to do better. They should get the testing.
Okay. Well, that's excellent advice. Um, Tell us a little bit more about when you found out when you were diagnosed. One of the big things that we have to do as men who are diagnosed with prostate cancer is we have to break the news to our family, to our wives, our significant others, our children, and what have you. And some guys even keep it a secret. What was your experience in terms of sharing your diagnosis with your wife, your children, and your family?
Well, I shared it with my wife. And of course, like I said, I was older. So we sat down and talked about it, and we determined it was survivable, and we need to do what we had to do so that I'd be here as long as I could be here. Uh, my wife really got on me. I didn't tell my kids until probably 2 years after I was diagnosed,
Mm.
and I can't tell you definitively why I didn't. Uh, it wasn't that I was ashamed of it, but it was because I guess I didn't. I already had one cancer, and I didn't need anybody feeling more sorry for me than they already was. But my wife convinced me that they had a right to know. The other thing I might say about that, since you brought it up, telling your kids, is I had to go through a genetic uh, test to
Mhm.
see if there were genetic markers, or if I had genetic markers that would have indicated that this was something that might be likely for my son and my grandson to have. And that was something that was very concerning to me, something that really worried me, because that's just not something that you like to do. Go tell your son, well, your pops gave you your genetic marker, and you might, turn up with the same thing I turned up with. Oh, and by the way, your grandfather had it too.
Oh, your father had it.
Yes.
So, you're a kind of a case study, so to speak, on the importance of screening, and also particularly for uh, men who have it as a trait in their families. Did you have any? So, since you found out about this so late in life, uh, did you have any symptoms? Were you aware of any symptoms
Well,
leading up to your diagnosis?
I was aware that I had probably had a prostate problem, but with my age, I thought it was an enlarged prostate that everybody else had at my age.
Hmm.
Uh, there was nothing that indicated to me that it would be cancer. I mean, Obama talks about being ready at 3 o'clock in the morning because he has to get up and go to the bathroom. Well,
Hmm.
that's the same thing with me. It was no worse than that. I had to get up and go to the bathroom like everybody else at 3 o'clock in the morning. That did not indicate to me that I had cancer. It indicated to me that I had enlarged prostate just like everybody else my age.
Okay, Ralph. So your story, actually, Elle told me a little bit about it yesterday, and I thought of it all night long, and even this morning. I don't know. I was bothered by it because I feel like along the way, some doctor failed you because I mean, I'm assuming that you were going for your physicals, and generally at 45, at least by 50, it is just recommended that you offer a guy a PSA screening. And it sounds like that was never offered to you along the way. And then the only time you know of a prostate issue or prostate cancer issue is when it basically has already metastasized and your PSA is 600. Am I understanding that correctly?
Yes, yes, and that was my impression too. I should have known about it long before it happened.
So I apologize, and I'm so sorry that you were failed along the way. But it sounds like that you're doing okay with treatment? Can you tell us like what's your, what kind of treatment are you having right now?
Okay, well, I'm doing as well as I guess anybody can be expect. The treatment that I'm having is nightly. I take tablets, and one of the things that it does is it suppresses my testosterone.
Mhm.
I think it's got a little chemotherapy mixed in it too, but it's been very effective. And I have to take um, prednisone with it uh, because it's strong. It has some effects, but I've been on it uh, since for 4 years. Okay, and every time they renew it, they ask me have I had any side effects, and so far none. When I first started, after the first 2 months, my PSA started dropping, and I think it dropped maybe 100 the first 2 months, and the next 2 months maybe it dropped 150. To eventually it got down to around 40 or 20. And it was a kind of joke with Dr. Razine when it got down to a -1, because I asked her if it got down to a -20, would I be in real trouble, and she just started laughing. But it's very effective. I also get a shot, and I can't tell you what the shot is. I can't pronounce it, but I get a shot every quarter when they take my blood as part of the uh, as part of as part of the program. And Dr. Razine tells me, of course, that as long as I'm getting a -1 as a PSA, I'm in good shape. But nobody knows how long that's going to last.
Mhm.
It's-
So I do want to make a note here. We've referred to Dr. Razine several times. Dr. Natalie Razine is at the University of Illinois at Chicago, and she's been a guest on our program. And she is the one that introduced us to Mr. Ralph Jones. So we just want to acknowledge her for that. And also, we want to acknowledge her and her team for getting you from 600 PSA to undetectable, and that undetectable number is less than 0.01, which is, thank God, what the readings that I have had recently. And so nothing makes a prostate cancer patient more happy than to get that PSA reading either in the mail or on your computer or whatever, and it says 0.0, less than 0.01, which means undetectable. So you had a rough start, but thank God you got some excellent care from Dr. Razine and the team over at UIC, and you're much better now. You look great to me. I tell you,
Well, I tell you what, when they told me it was 600, I didn't think I was going to get here. I mean, I thought I was in real trouble, and started making plans for not being here.
right, right.
But so far, so good. I mean, there's side effects to the medication and what have you, but nothing that is not nothing that you can't handle, and nothing that is an absolute benefit compared to where I was.
Just a reminder, to ensure that you stay up to date on the latest episodes from Prostate Cancer Real Talk, don't forget to hit that subscribe and like button.
So Ralph, like, how do you feel now? What can you tell the listeners, like, what your quality of life is now, having gone from a 600 PSA to, being undetectable, your PSA level? Can you tell the listeners how you feel and what's your quality of life is like?
Well, comparatively speaking, I feel great. Okay. I mean, emotionally and physically, I feel a lot better. That's a hard question for me because I just don't have prostate cancer. I got a carcinoid tumor. I got
What's that? Explain that, please.
okay, a carcinoid tumor. A carcinoid is a cancer, but what it does is it causes fatty tissue to grow through organs. So I've had a situation where I've had bowel obstructions because the carcinoid tumor has grown through my intestines, and that's happened twice. I also had colon cancer. Now, in all three of those situations, they took out some of my intestines. So I have less intestines than the average brother, okay? And one of the problems with the carcinoid tumor is that it emits a hormone that aggravates diarrhea. So one of the things that I have is I have chronic problem with diarrhea, and that kind of got into that affected my choices when it came to the treatment of the prostate cancer. Because when my father went through it, he they did the radical, the whole thing, and he was incontinent, totally incontinent. And when it came to offering what the alternative treatment was, I turned down the surgery because having chronic diarrhea and having a situation where you were incontinent just would have left me, as far as I could see, dysfunctional. And I've been doing a lot of things with youth, a lot of things with developing a chess strategy that will strengthen use cognitive skills and what have you. And I wasn't ready to give that up. And I wanted to completely be functional. But other than that, I mean, I feel I don't have the energy that I used to have. But then too, I'm almost 80 years old. So I got a sneaky feeling that that's got something to do with it.
Well, God is good. You're almost 80. God is good.
Yes, he is. And I'm not arguing with him. So,
that's right.
So as far as my quality of life is concerned, I've got some limitations. But generally, I get to do the things that I really wanted to do. I think my quality of life is good and my life is rewarding. And so as far as I'm concerned, I'm very thankful for the ability to master or control these diseases to the point that I can function the way I'm functioning.
Well, I will tell you that you are an inspiration.
Yes.
Because you've gone through and you're going through so much, but your attitude is so positive, and that demonstrates that what they used to say when we were kids is, your attitude determines your altitude, and that really is the case with you.
Ralph, thank you for being on the podcast.
The study medicine in the MEVPRO clinical trials is designed to block the abnormal EZH2 activity in cells. With the study medicine's help, the abnormal EZH2 no longer promotes cell growth, and the flow of traffic returns to its normal state, and tumor growth is delayed or prevented. The goal of the MEVPRO clinical trials is to determine whether this study medicine, taken as tablets by mouth, is safe and effective. During these clinical trials, you will have regular visits to the study site, and your health and cancer will be closely monitored by medical professionals. You may experience side effects from the study medicine, such as diarrhea and fatigue. More information will be provided during the informed consent process.
find out more information on the guest you just heard or previous guests and a list of Prostate Cancer Real Talk episodes, visit our website, prostatecancerrealtalk.com. And if you have a question, comment, or if you would like to share your story, send Elle and Shay an email, ellandshay@prostatecancerrealtalk.com. That's L-E-L and Shay, S-H-A-Y, at prostatecancerrealtalk.com.